Welcome to PCIN's Introduction to Managed Care course. We're excited to get started and teach you the fundamentals of managed care. Let's go over the objectives for the Introduction to Managed Care course. At the end of the session, the learner will be able to define what is managed care. The learner will understand the different types of insurance, the different pricing strategies for medications, and will be able to understand pharmacy network arrangements. The learner will also understand what pharmacy benefit managers or PBMs provide, understand how pharmacies, and PBMs generate revenue, and the learner will be familiar with the different parts of a PBM contract. So, what is managed care? Managed care is a combination of both delivery and financing. What that means is healthcare has to be delivered, and it is delivered within a system. This system is then organized to manage cost, utilization, and quality. Insurance, on the other hand, is financing of these covered services. So you had the healthcare delivery system. So this could be your hospital, this could be your primary care practices. They are delivering care to your actual patients. But who pays for that? That's where the insurance come in. So insurance is the financing, healthcare delivery system is the delivery, and when you put these two together, you come up with managed care. Let's explore the history of insurance. Oftentimes, when you think of health insurance, the first company that comes to mind is Blue Cross Blue Shield. So, how did they get started? Blue Cross started in 1929, and it was a partnership between a local hospital and Dallas public school teachers who were struggling financially. It was known as the Baylor Plan, and members prepaid 50 cents a month in order to stay up to 21 days in the hospital every year if needed. This soon spread to other professions. The Blue Shield component was a similar arrangement that began in the early 1900s between Pacific Northwest loggers and miners, but instead of a hospital arrangement, it was a partnership between individual providers and physician groups to provide medical services for a monthly fee. So essentially, Blue Cross was the hospital coverage, Blue Shield was the medical coverage, and when they came together in the 1940s, this comprehensive coverage was available to over 24 million lives. Today, Blue Cross companies have a healthcare option for every zip code, providing coverage to almost 115 million members in all 50 states. Nationwide, more than 1.7 million doctors and hospitals contract with Blue Cross Blue Shield more than any other insurer. Title 19 of the Social Security Act was signed into law in 1965. This established both Medicare and Medicaid. We will certainly dig deeper into Medicare throughout this course, but let's talk about some of the basics now. When signed into law, Medicare comprised of Part A, which was our hospital coverage, and Medicare Part B, which was our medical coverage. The people who were originally eligible were seniors that were 65 years of age and older. It was later expanded to cover the disabled, who may be under the age of 65, those with end-stage renal disease or kidney transplant, and in 2003, the Medicare Modernization Act established Part C, or better known as Medicare Advantage plans. In 2006, along comes the prescription drug coverage, or Medicare Part D. Interesting fact that when Medicare was signed into law in 1966, Blue Cross Blue Shield companies were the only insurers with the claims processing capability and computing power to administer the new program. In its new role, Blue Cross seamlessly processed the claims of nearly 5 million Medicare patients that first year. Medicaid, on the other hand, is administered by each individual state with some federal parameters set in place. It is designed for those who are low-income individuals and families, children, pregnant women, seniors, and persons with disabilities. Now let's talk about the Affordable Care Act, also known as Obamacare, Patient Protection and Affordable Care Act, PPACA, and Marketplace, that was established and signed into law in 2010. The coverage is intended to be an affordable option for individuals and families that may not have access to private insurance through an employer, Medicaid, Medicare, or the VA. The premium tax credits, also known as subsidies, are paid by the government to the health plan to help make it more affordable for the member. PPACA also allow for states to expand their Medicaid eligibility, which we will discuss in detail later. This concludes the first part of the curriculum, providing an overview and history of managed care. Next, we will discuss the different types of insurance in detail.